Do your knees crack when you get up? Do your hands feel stiff in the morning? Do your joints feel older than the rest of your body? It's not just age. It's a warning. Your joints are breaking down. Slowly, quietly. But there's one vitamin that can help reverse the damage. Naturally, without painkillers, without expensive procedures. It helps rebuild cartilage. It reduces inflammation. And it protects your bones. But here's the problem. Most people don't get enough. And even when they do, they take it the wrong way. In this video, you'll learn the real reason joints get worse with age, why this vitamin is more important than calcium, how to take it the right way, and 7 simple things to do each day to feel younger, stronger, and more flexible. Let's begin. Part 1. What happens to joints after 60? After 60, joints change. Cartilage wears out. Bones lose density. The fluid inside your joints dries up. Tendons stiffen. Muscles around the joints shrink. All of this leads to pain while walking, popping and grinding sounds, swelling in the knees or fingers, difficulty climbing stairs, stiffness in the morning, weak grip strength. But here's the truth. It's not just aging. It's inflammation. It's nutrient loss. It's lack of movement. And it's years of missing the one vitamin that protects your joints. Which vitamin? We'll get to that in a minute. But first, let's understand why most joint problems are not permanent. Your joints can heal. Your body can repair cartilage. It just needs the right support. Part 2. Why calcium alone isn't enough. Most people believe calcium is the answer. They take calcium pills. They drink milk. They eat cheese. But their joints still hurt. Why? Because calcium needs a guide. If you take too much calcium without balance, it can go to the wrong places. Instead of strengthening bones, it ends up in your arteries, or in your kidneys, or in your joints, where it causes stiffness. This is called calcification. It's one of the hidden reasons. Your joints become rigid. So it's missing a vitamin that directs calcium to your bones and away from soft tissue. And that vitamin is Part 3, the forgotten vitamin, K2. Vitamin K2. You've heard of vitamin K, but K2 is different. It's the key to healthy joints and bones. Here's what it does. Part 4. How to take vitamin K2 the right way. It's not just what you take. It's how you take it. Here's how to use K2 properly. 1. Take it with fat. K2 is fat soluble. That means it absorbs best with healthy fats. Example. Take it with eggs, avocado, olive oil, or nuts. 2. Pair it with vitamin D3. K2 and D3 work as a team. D3 helps absorb calcium. K2 directs that calcium to your bones. 3. Don't take calcium without K2. They must go together. Otherwise, calcium may end up in your joints, not your bones. 4. Use the right form. There are 2 main types, -4 Malawian Quatches and -7 Malawian Quatches. -7 Malawian Quatches stays in your body longer. It's better for long-term support. 5. Be consistent. This is not a one-time fix. Take it daily. Give it time. Real results take 3 to 6 weeks. And here's the secret. When taken right, K2 can help you feel looser, stronger, and lighter without medication. Part 5. 7 daily habits to help joints regenerate. K2 is powerful, but it works best with daily habits. Here are 7 things to do every day to support your joints. Wide heavy check mark, gentle morning stretches. Loosen the joints after sleep. Focus on knees, hips, fingers. Wide heavy check mark, stay hydrated. Joints need water to stay cushioned. Drink herbal teas and water. Avoid soda. Wide heavy check mark, add turmeric or ginger. These reduce inflammation naturally. Wide heavy check mark, walk for 15 to 30 minutes. Keeps fluid moving inside your joints. Strengthens surrounding muscles. Wide heavy check mark, avoid cold, hard floors. Walking barefoot on cold tiles. Stiffens your joints. Use soft slippers or socks. Wide heavy check mark, use warm compresses, especially on knees, hands, or shoulders. Increases blood flow and relaxes tissue. Wide heavy check mark, massage with sesame oil. This improves circulation and supports joint lubrication. These small habits make a big difference, especially with K2. Part 6. Warning signs your joints need help. Don't wait until things get worse. Here are signs your joints are in trouble. Prohibited stiffness that lasts over 30 minutes. Prohibited pain during light activities. Prohibited swelling that comes and goes. Prohibited reduced flexibility. Prohibited grinding or popping sounds. Prohibited pain during rest. These are not normal signs of aging. They are red flags. They say, give me support. Give me nourishment. Pay attention now before it's too late. The earlier you act, the better your joints can recover. Conclusion: you can rebuild naturally. Your joints are not broken. They're overworked, underfed, and asking for help. With the right habits, with the right nutrients, you can move better, feel stronger, and avoid surgery or drugs. Vitamin K2 is not a miracle, but it's a missing key. Start using it right. Add the habits we shared today. Track how you feel in 7 days. In 14, in 30, you may notice wide heavy check mark, less stiffness. Wide heavy check mark, easier walking. Wide heavy check mark, stronger knees. Wide heavy check mark, better grip. Wide heavy check mark, more confidence. You deserve to move without pain. You deserve to enjoy your day without worrying about every step. Let this be your turning point. It starts today.